Hi, welcome back. I'm so glad you are continuing your medical terminology studies with Course 3, Brain, Nerves, Senses, Digestion, and Reproduction. In this course, we will explore new medical terms related to the nervous, special senses, digestive, and reproductive systems. But first, some fun facts. Did you know there are more neurons in the brain than there are stars in the Milky Way galaxy? Did you know that the eyes are the same size throughout life, but the ears and nose never stop growing? Don't believe me? Check them out on your great-grandparents. Also, did you know that platypuses don't have stomachs? Unrelated to the course, but fun. Finally, did you know that females are born with their entire supply of primary oocytes? Yep, around 1 million of them. That means you are literally 1 in a million. Aren't you special? Fascinating. Without further ado, enjoy learning about medical terms related to the nervous, special senses, digestive, and reproductive systems. Salutations! Glad you're here. In this lecture, we will begin our exploration of medical terminology as it relates to the nervous system. Let's get started. And don't be nervous, it's going to be fine. Our knowledge, perception, and response to the world around us are all due to the nervous system. The nervous system also coordinates the activities of the body. It receives sensory information from both inside and outside of the body. It then interprets the information and decides what to do with it. Fun fact, the fastest signal transmission in the body occurs in the alpha motor neurons within the spinal cord. They transmit a signal at 268 miles per hour. The slowest signal transmission is within the skin at 1 mile per hour. Let's begin by looking at the basic purposes and anatomy of the nervous system. But first, let's look at this adorable baby sea lion. One primary purpose of the nervous system is to coordinate the body systems and allow them to communicate with each other for a common goal, kind of like this telephone switchboard. The sensory system, like our eyes, ears, nose, and skin, detects information from the outside environment and sends it to the brain via nerves. Nerves can be thought of as wires that connect the sensory organs to the brain. The brain makes sense of the information and determines what it will do with the information. This action plan is then sent out to the other organ systems via nerves. The branch of medicine that deals with the nerves and organs of the nervous system is neurology. The nervous system is also involved in how we behave and respond to the environment around us. When an event happens to us, we react with our emotions and express our opinions and beliefs. Most of us have many feels. However, my husband hates talking about feelings and says he only has 2. Hungry and sleepy. There are 2 different medical specialties that deal with problems in our perceptions, emotions, and behavior: psychiatry and psychology. The nervous system is divided into 2 parts, the central and peripheral nervous systems. The central nervous system is made up of the brain and the spinal cord. The peripheral nervous system is made up of the nerves that send information to and from the central nervous system. There are 2 main divisions of action, voluntary and involuntary. Recall that the central nervous system is made up of the brain and spinal cord. We will look at new word roots pertaining to the central nervous system next. The cerebrum is what we traditionally call the brain and is sectioned into lobes. The cerebrum can also be divided into left and right hemispheres. There are multiple word roots that all mean brain. They include cerebro and encephalo. You can see them in words like cerebrospinal and encephalitis. The cerebrum can be further subdivided into lobes or specialized areas of the brain. The word root for lobe is lobo. Lobo is also Spanish for wolf, totally unrelated, but you're welcome. The cerebellum is at the base of the cerebrum and controls things like coordination of movements. I like to say that the cerebrum allows you to walk, but the cerebellum allows you to dance. Cerebello is our root that means cerebellum and can be seen in the word cerebellar, which means pertaining to the cerebellum. Fun fact, although it only accounts for about 10% of the brain's volume, the cerebellum contains over 50% of all of the brain's neurons. There are 2 word roots for head, cephalo and cranio. Cranio can also be used to mean skull, as shown here. You can see them in the words microcephaly and cranial orthosis. The opposite of microcephaly is macrocephaly, which is what happened to your ex when they got discovered by that talent agency. Oh. So far, we have roots for the brain portion of the CNS, but not the spinal cord. Not fair! Don't worry, we're now making it right. Myelo means spinal cord. There, now everyone has been acknowledged. I mentioned earlier that a specialist in the nervous system is called a neurologist. The root neuro is pretty common and means nerve. A group of nerve cell bodies or a nerve bundle is called a ganglia, used in the other root seen here, ganglio. And now for a 10-second brain break. In the previous section, we focused on neurology word roots. The following section will focus on the psyche, which is Greek for mind. Our first word roots related to the psyche are phreno and psycho, which both mean mind. Phreno can be seen in schizophrenia and psycho in the term psychic or psychology. The root estheo means feeling or sensation. I'm sure you've heard this one used in terms like anesthesia, which is of course a drug that creates a lack of sensation, as in during a surgical procedure. They also use anesthesia for dental procedures that allow the patient to remain conscious. Sleep has 3 word roots: somno, somnio, and hypno. You've probably seen them in words like insomnia, or the inability to sleep, and hypnosis, which is a condition of sleep. Meaning knowledge, noceo has already been used quite a bit in the course, and I bet you didn't even acknowledge it. Get it? Acknowledge it, because noceo means knowledge. We use it every time we say the word diagnosis. Although the focus has been on new word roots, there are also some suffixes specific to the psyche. Our first suffix is phobia, which means an excessive fear or sensitivity. It can be seen in botanophobia, or a fear of plants, and ombrophobia, or a fear of rain. Another suffix related to the psyche is mania, or an excessive desire. Other manias include kleptomania and, the buzzword around my house, pyromania. Don't worry, we have 4 fire extinguishers, seriously, and we know the fire chief. Finally, these suffixes are also commonly used in neurology. Paresis means a slight or partial paralysis. Plegia means paralysis and can be seen in the word hemiplegia, or paralysis of one side of the body. Asthenia means weakness, as seen in myasthenia gravis, which is a weakening of the skeletal muscles, particularly in the face. As with all good things, this lecture too must come to an end.
Right.
Thanks for exploring introductory terms and roots related to the nervous system with me. See you next time. Welcome. I'm glad you're here. In this lecture, we will discuss some common medical terms related to the nervous system that you might find in the subjective portion of a neurology, psychology, or psychiatry note. Recall the subjective section contains things the patient reports. Patients will usually have complaints that can be categorized into problems with either the central or peripheral nervous system. Remember that these terms are not a particular diagnosis in themselves, but rather symptoms used to generate a forthcoming diagnosis. The first common complaints include cephalalgia or cephalodynia. Both are literally translated head pain, but might more commonly be reported as a headache. You know, like when you see this.
No.
Sometimes patients will come in reporting issues with their ability to sleep. Insomnia is when someone cannot sleep. Did you know that pets and even bugs can also suffer from insomnia? So the next time you see that poor fly buzzing around restlessly, please share the sure cure for insomnia: my syllabus! Yep, guaranteed to put you out like a light. Moving on. Syncope is the medical term for fainting or losing consciousness due to temporary loss of blood flow to the brain. Syncope was very prevalent in the 1700s and 1800s, when women's fashion often cut off blood flow and the ability to breathe. So common was the occurrence that fainting couches were actually designed and sold to cradle the dear lady as they swooned. Obviously, this person missed. Sometimes damage to the CNS can result in partial or full loss of sensation and movement in part of the body. Known as paresis and paralysis respectively, these conditions are usually permanent, as the central nervous system does not regenerate. Using prefixes that you already know, you can further describe the loss of sensation and movement as hemi or monoparesis, or hemi or monoplegia, meaning loss in one limb versus one half of the body. Aren't you glad you took my advice and memorized all those word parts at the beginning? You're welcome. In addition to these common complaints, some patients may complain about conditions related to abnormal sensations. Just so you know, unless you're a spider or Spider-Man, tingling is not a normal sensation. Which leads us to our first complaint involving abnormal sensation. Paresthesia, or tingling, can be the result of a damaged nerve or something as simple as temporarily compressing a nerve. Have you ever had your hand or foot fall asleep? When you move it again, you might immediately feel that pins and needles sensation, which is used to describe paresthesia. If temporary nerve compression is the cause, rest assured that it will probably resolve on its own in a matter of seconds. Just try to hold perfectly still until then. The next abnormal sensation is pseudoesthesia, meaning false sensation. This is commonly reported among people who have had amputations and is more commonly known as phantom limb pain. These patients often report feeling pain or other sensations in the missing limb. Synesthesia occurs when one sensation is experienced as another and occurs in less than 5% of the general population. Simply put, when one sense is activated, another unrelated sense is activated at the same time. This may, for instance, take the form of hearing music and simultaneously sensing the sound as swirls or patterns of color. At the beginning of this section, I mentioned that nerve pain often results in a burning sensation. The specific medical term for this sensation is causalgia. Commonly attributed to damage to a peripheral nerve, it can be extremely painful and debilitating. Aww. And now for a 10-second brain break. Look at the cute baby bird. Our next topic related to the subjective terms of the nervous system involve common psychiatric complaints. Depression is a mental health disorder that leads to a persistent feeling of sadness. It can also be characterized by persistently depressed mood or loss of interest in activities, causing significant impairment in daily life. Anxiety is a mental health disorder characterized by feelings of worry, anxiety, or fear that are strong enough to interfere with one's daily activities. Examples of anxiety disorders include panic attacks, obsessive-compulsive disorder, and post-traumatic stress disorder. Symptoms include stress that's out of proportion to the impact of the event, an inability to set aside worry, and restlessness. Another common psychiatric complaint are phobias or abnormal fears. A type of anxiety disorder, phobias are defined by a persistent and excessive fear of an object or situation. Phobias typically result in a rapid onset of fear and are present for more than 6 months. The following slides include common phobias with which you should be familiar. Acrophobia is an abnormal fear of heights. Agoraphobia is an abnormal fear of outdoor spaces. Hydrophobia is an abnormal fear of water. And photophobia is an abnormal fear of light. Finally, I would like to conclude this lecture with a few subjective nervous system terms that might come in handy should you find yourself trying to avoid a particularly sticky situation. These terms are being provided for educational purposes only. Any use for personal gain, either real or imagined, is not being endorsed by this professor, this department, this university, or any of their affiliates. Use at your own risk. Our first ominous-sounding nervous system disorder is encephalalgia, as in, I'm sorry, Dr. Bob, I really wanted to come to your 4-hour lecture on the feeding habits of the dodo bird this Saturday at 6 a.m., but I'm coming down with encephalalgia. And the best part is that it's probably true. 4 hours of lecture on the gut of an extinct bird at 6 on a Saturday morning probably does bring on brain pain. If that doesn't work, you might try somnambulism. Yes, Dr. Bob, I know that I could just take some Tylenol and give it a try, but I'm also suffering from somnambulism and would hate for anyone to catch it. The medical term for sleepwalking that should ensure that you are snoozing comfortably in bed this Saturday. As with all good things, this lecture too must come to an end. Thanks for exploring subjective terms related to the nervous system with me. See you next time. Hi, you're back, and so am I. What a coincidence. Since we're both here, we will discuss some common medical terms related to the nervous system that you might find in the objective portion of a healthcare record. Recall that objective terms are those that the practitioner will observe or discover through labs or tests. They are used to describe what they find in their examination. With the nervous system, this might mean a physical or mental evaluation. Neurologic exams are thorough and include examinations of muscle strength and coordination, sensation, and reflexes. In addition to CAT scan and MRI imaging tests, here are a few other tests common to neurology. Your doctor may order a PET or positron emission tomography scan to inspect blood flow, oxygen intake, or the metabolism of your brain. The scan uses a special dye containing radioactive tracers that are either inhaled, swallowed, or injected into a vein in your arm. The tracer will collect in areas of higher chemical activity, which is helpful because certain tissues of the body and certain diseases have a higher level of chemical activity. PET scans are most commonly used to detect cancer and other problems with the central nervous system. Magnetic resonance imaging, or MRA, uses a magnetic field, radio waves, and a computer to create images of soft tissue, bones, and internal body structures. An MRA of the brain is used to produce two three-dimensional images of the blood vessels of the brain. MRA is primarily used to detect narrowing of the arteries and to rule out aneurysms. Ultrasounds are usually thought of as ways to see a baby before it is born. However, did you know that there are also diagnostic uses for ultrasound? No? You didn't know? Wait, yes? You did know? Now I'm confused. But there are! Echoencephalography. Echoencephalography is an imaging test that uses ultrasound or sound waves to generate an image of the brain. Transcranial Doppler sonography is a specific kind of echoencephalography that produces images of the brain using sound waves sent through the skull as shown here. It is painless and non-invasive. Bonus! Electroencephalography, or EEG, is a recording of the electrical activity of the brain. An EEG can determine changes in brain activity that might be useful in diagnosing brain disorders, especially epilepsy or another seizure disorder. In fact, I had one for just this purpose after a tonic-clonic seizure I had at 13. Like a typical teenager, all I remember is that the glue they used to place the electrodes stayed in my hair for days. This patient won't have that issue. And don't worry, my brain was fine, mostly. A neurologist might also want to check for an infection in the central nervous system. This is often done through a lumbar puncture, where cerebrospinal fluid, or CSF, is removed and sent to the lab for analysis. It is called a lumbar puncture because it is performed in the low back or lumbar area in an attempt to minimize the odds of hitting and damaging the spinal cord. Fun fact, CSF actually allows the brain to float. After a lumbar puncture, patients are required to lie flat for a while. If they were to sit or stand, not only could they spring a leak or have issues with the sample site, but they would also have a massive headache. Why? Without enough CSF, the brain would rest on the skull, thus creating the headache. And now for a 10-second brain break. From these tests we just discussed, doctors might find some of the following abnormal results. One abnormal finding might be a hematoma, or a tumor-like mass filled with blood. Often, hematomas are named for where they are located in the brain. A cranial hematoma is a hematoma beneath the skull. An epidural hematoma is on top of the dura. An intracerebral hematoma is inside the brain, like the one shown here, and a subdural hematoma is beneath the dura. Another finding might include cerebral atrophy, or a wasting away of brain tissue. Stroke and traumatic brain injury, as well as Alzheimer's disease, can also cause cerebral atrophy. Micro and macrocephaly are conditions associated with the size of the skull. Microcephaly means an abnormally small skull, while macrocephaly means an abnormally large skull. This is why babies' heads are measured so often during their first year of life, to check for micro or macrocephaly. A neuroma is a nerve tumor. The one shown here is an acoustic neuroma, which is a rare, benign, or non-cancerous, slow-growing tumor that develops from the balance and hearing nerves supplying the inner ear. Other common neuromas include Morton's neuroma, which develops on the ball of the foot. As with all good things, this lecture too must come to an end. Thanks for exploring objective terms related to the nervous system with me. See you next time. Welcome! Are you ready for the best lecture ever? Yes! Me too! It's definitely not this one. In this lecture, we will discuss some common medical terms related to the nervous system that you might find in the assessment portion of a clinic note. Terms associated with assessment are used when the healthcare provider has gathered the patient's subjective information and his or her objective information. With the nervous system, conditions can be either neurogenic or psychogenic. This doctor is clearly a neurologist because they are looking at a picture of brains. And they're clearly a doctor because they're wearing a stethoscope. It's not like you can just buy those things off the internet. Context clues. You're welcome. Neurogenic conditions can include disorders of the skull, blood supply, or injury. Let's take a look at some of the ones that are more commonly seen. But first, our daily dose of cuteness. Aww. Look, they're making friends. Up first, a disorder of the skull. Craniosynostosis is a premature fusion of the skull bones. The spaces between a typical baby's skull bones are filled with flexible material and called sutures. These sutures allow the skull to grow as the baby's brain grows. Around 2 years of age, a child's skull bones begin to join together because the sutures become bone. When this occurs, the suture is said to close. In a baby with craniosynostosis, one or more of the sutures closes too early. This can limit or slow the growth of the baby's brain. Have you ever been told that babies have a soft spot on their head? It's actually called a fontanelle, and it is where the baby's sutures are still open. In order to squeeze through the birth canal, the skull bones are unfused at birth. You can actually see the baby's pulse at the fontanelle. Pretty cool and frightening. Be careful with babies. The next conditions relate to neurogenic conditions due to blood supply issues. Perhaps you've heard of a stroke. The medical terminology for stroke is a cerebrovascular accident, or CVA. A CVA results when the brain does not have adequate blood flow for a prolonged period of time. There are two main types of strokes, hemorrhagic and ischemic. Hemorrhagic strokes are caused by a rupture in a blood vessel that supplies the brain with blood, whereas ischemic strokes are caused by a blockage in a blood vessel to the brain. Either way, it is an emergency situation and you need to think fast. Fast! Face, arm, speech, and time. Ask the person to smile. If one side of the face droops, it might be a stroke. Ask them to raise both arms. If one arm lags or is weaker, it might be a stroke. Ask them to talk. If their speech is jumbled, slurred, or doesn't make sense, it might be a stroke. With any of these symptoms, time is of the essence. Call 911. The sooner they get medical attention, the better the outcome. A cerebral aneurysm is a weakness in a blood vessel in the brain that balloons and fills with blood. Most intracranial aneurysms occur between the underside of the brain and the base of the skull. The aneurysm can leak or rupture, causing life-threatening bleeding. An unruptured aneurysm usually causes no symptoms. A key symptom of a ruptured aneurysm is a sudden severe headache. Any sudden severe headache should be taken seriously. However, not every headache is an aneurysm. Sometimes it's just normal stress. True cerebral aneurysms occur in less than 1 in 200,000 individuals and can be managed if caught early. Meningitis is an inflammation of brain and spinal cord membranes, typically caused by an infection. Meningitis is usually caused by a viral infection, but can also be bacterial or fungal. Vaccines can prevent some forms of meningitis. Symptoms include headache, fever, and stiff neck. Screening usually consists of asking the person to touch their chin to their chest to check for this last symptom. In fact, let's all do the meningitis screen now and then work our way into a nice 20-second stretch break. All right. Now that we're all stretched, let's look at some diagnoses related specifically to psychogenic conditions. Psychogenic problems can occur due to depression and/or anxiety. They can also occur due to distorted perceptions such as hallucinations. Our first psychogenic diagnosis to discuss is anorexia. Anorexia is disordered eating causing people to obsess about weight and what they eat. Anorexia is characterized by a distorted body image with an unwarranted fear of being overweight. Symptoms include trying to maintain a below normal weight through starvation. However, did you know that excessive exercise can also be a part of anorexia? Compulsive exercise to burn off any food that is consumed can also be a symptom. Our next psychogenic diagnosis is bulimia. Bulimia is another eating disorder marked by binging, followed by methods to avoid extreme weight gain. Unlike anorexia, people with this condition binge eat. They then take steps to avoid weight gain, most commonly vomiting or purging. However, excessive exercising or fasting can also be a symptom. Epilepsy is a disease marked by repeated seizures from abnormal electrical brain activity. It may occur as a result of a genetic disorder or an acquired brain injury, such as trauma or stroke. During a seizure, a person experiences abnormal behavior, symptoms, and sensations, sometimes including loss of consciousness. There are few symptoms between seizures. Finally, narcolepsy is a disease characterized by sudden, uncontrolled sleepiness. It is a chronic sleep disorder that causes overwhelming daytime drowsiness. The cause of narcolepsy isn't well understood, but may involve genetic factors and abnormal signaling in the brain. Narcolepsy causes sudden attacks of sleep. Sudden loss of muscle tone and hallucinations might also occur. And no, just because you fall asleep during your midterm lectures does not mean you have narcolepsy. As with all good things, this lecture too must come to an end. Thanks for exploring assessment terms related to the nervous system with me. See you next time. Welcome back. In this lecture, we will discuss some common medical terms related to the nervous system that you might find in the plan portion of a healthcare record. Recall that plan terms refer to the treatment or therapy that the practitioner has decided will best address the diagnosis from the assessment section. In the nervous system, treatment options usually consist of medication, surgery, and therapy. There are three main classes of medications that treat conditions of the nervous system: anesthetics, anticonvulsants, and psychiatric medications. We will look at these classes in more detail on the coming slides. Neuropharmacology is the study of how drugs affect cellular function in the nervous system and the neural mechanisms through which they influence behavior. There are two main branches of neuropharmacology: behavioral and molecular. Behavioral neuropharmacology includes the study of how drug dependence and addiction affect the human brain. Molecular neuropharmacology aims to develop drugs that have beneficial effects on neurological function. Anesthetics can be given to stop the brain from detecting pain in a small area or over the entire body. Local anesthetics can be delivered topically, as in the patch seen here, by injection or with indwelling pain pumps. General anesthetics, on the other hand, cause a complete lack of consciousness. Anticonvulsants are medications used to treat seizures. They work by suppressing the excessive rapid firing of neurons during seizures and/or preventing the spread of the seizure within the brain. Hypnotics are commonly known as sleeping pills. They are a class of medication whose primary function is to induce sleep. They are used for the treatment of insomnia or for surgical anesthesia and are related to sedatives. This slide is a different kind of hypnotic. Look deeply into the center of the image. Deeper, deeper, deeper. Wait, what happened? Where are we? Oh yeah, midterm. Medications, hypnotics, thrombolytics. Thrombolytics are used to dissolve dangerous clots in blood vessels, improve blood flow, and prevent damage to tissues and organs. They are more commonly called clot busters and can literally save lives. Thrombolytics are part of the reason it is so important to get immediate medical attention if you suspect someone is having a stroke. The quicker blood flow is returned to the organ, or in this case the brain, the less severe the damage. A final class of medications, chemotherapy, literally translates to treatment with chemicals. This is a broad term for any drug used to treat cancer. Side effects vary widely based upon the type and strength of the medication. In the case of the nervous system, chemotherapy would commonly be used to treat malignant or cancerous tumors of the brain. And now for a 10-second brain break. Psychiatric medications can be used to control symptoms of the nervous system that manifest due to how the patient interacts with their environment, including their behavior and emotions. Psychopharmacology is the scientific study of the effect drugs have on mood, sensation, thinking, and behavior. It is distinguished from neuropharmacology mentioned earlier, which emphasizes drug-induced changes in the functioning of the cells in the nervous system. Closely related to psychopharmacology, a psychotropic drug is what is studied in psychopharmacology. Psychotropic drugs are those medications which affect the mind. Fun fact! Psychotropic drugs are also found in nature. They are the magic behind magic mushrooms, also known as things like shrooms, mushies, and philosopher's stones. Many mushrooms are classified as a hallucinogenic. Moral of the story: stick to the grocery store for your stir-fry ingredients. Antipsychotics, also known as neuroleptics, are a specific class of psychotropic drug. These medications are used to manage psychosis, including delusions, hallucinations, paranoia, or disordered thought. Used primarily in schizophrenia, antipsychotics can also be used in a range of other psychotic disorders. If a patient is diagnosed with severe anxiety, an anxiolytic might be prescribed. Can you hear the word anxious and anxiolytic? I can. An anxiolytic is a medication or other intervention that reduces anxiety. Finally, antidepressants are medications that can help relieve symptoms of depression, social anxiety disorder, anxiety disorders, and seasonal affective disorder, as well as other common conditions. Fun fact! Exercise can be just as effective as antidepressants in some cases. Exercise causes the body to release its own endorphins, or feel-good chemicals, and can also help enlarge the hippocampus. The hippocampus is the region that helps regulate mood in the brain and can be smaller in people with depression. So, while it might not work for someone with severe depression, it can help relieve mild depression without all of the side effects of a pill. I can personally attest to the power of exercise in my own mood stability and depression. It works, and it's free. Surgical interventions for the nervous system include those to remove clots that are blocking blood flow to the brain. Parts of bones can also be removed in order to relieve pressure in the brain or on nerves, such as the spinal nerve. Surgical procedures to repair nerves are a third main class of surgical intervention for the nervous system. Let's look at a few of these in more detail. Endovascular neurosurgery is a subspecialty within general neurosurgery. It uses catheters and radiology to diagnose and treat various conditions and diseases of the central nervous system. It allows the neurosurgeon to access your nervous system through your blood vessels, which is much less invasive than going through the brain or spinal column. Another type of surgery performed on the central nervous system is a lobectomy, or removal of a lobe of the cerebrum. Lobectomy is the most common operation for epilepsy. During this procedure, a neurosurgeon removes the portion of one lobe that is causing the seizures. The surgery is performed under general anesthesia, and the recovery time in the hospital is usually 24 hours. Finally, a craniectomy is a surgery done to remove a part of the skull in order to relieve pressure in the area when the brain swells. A craniectomy is usually performed after a traumatic brain injury. It's also done to treat conditions that cause the brain to swell or bleed. The portion of the skull that is removed can be placed under the patient's skin in their own abdomen for safekeeping until it is ready to be placed back in the head. Cool, huh? As with all good things, this lecture too must come to an end. Thanks for exploring play and terms related to the nervous system with me. See you next time. Hi, welcome to class. In this lecture, we will begin our exploration of medical terminology as it relates to the sensory system, and in particular, the eye and the ear. Let's get started. The function of the sensory system is to collect details about the surroundings and send that information onto the central nervous system. The branches of medicine that specialize in the vision and hearing portions of the sensory system are called ophthalmology and otolaryngology, respectively. Let's begin by looking at the eye. Wait, can one look at one's own eye? Perhaps in a mirror? We'll just stick to its purpose and new word roots. But first, let's look at this adorable baby kitty cat. Whoa, that's a wild kitty cat. The major function of the eye is to provide sight. It is protected by the bones of the skull. Teenagers often forget the main purpose of the eye and instead choose to use them to express just how much they appreciate all the wisdom so lovingly imparted by their elders. Although I'm sure you never did that. Such angels. There are multiple word roots that all mean eye. They include oculo, ophthalmo, and opto. You can find them in words like ophthalmologist and optometrist. Tears are designed to keep the eyes moist. They are produced by the lacrimal gland located superior to the eye. As you can see in the name of the lacrimal gland, both lacrymo and dacryo mean tear. The tears flow across the surface of the eye and are collected by the lacrimal duct. The tears are then drained into the nose. That's right, the tears are drained into the nose. That's why when you ugly cry, you also snot. Or if you're trying to pretend that you're an adult now and that Disney movies don't affect you anymore and attempt to suck up that tear in your eye, it just drips out your nose. If you don't let them come out of your eyes or nose and you try to sniff them back in, they go into your throat. One way or another, they're coming out. Everything's connected, people. Blepharo is the word root for eyelid. Eyelids protect the eyes from dust and other floating particles in the air and help to keep the eye moist. And they help to keep that eyeball firmly in the socket when you sneeze. Thank goodness. The outermost layer of the eye is made up of the sclera and the cornea. The sclera is the white of the eye. Sclero is the root for sclera. The cornea is clear and covers the front portion of the eye. Corneo and cerato both mean cornea. Fun fact, the cornea contains no blood vessels. That's right, zero, zippo, none. And you can have a corneal transplant. Perhaps consider donating yours when you're done with them to give someone else the gift of sight. You can have mine, but not yet. The conjunctiva lines the upper and lower eyelids and most of the surface of the eye. It is a loose connective tissue that covers the surface of the eyeball and then reflects back upon itself to form the inner layer of the eyelid. When you get an itis of your conjunctiva, it is called conjunctivitis, or as it is more commonly known, pink eye. The highly contagious disease causes an inflammation of your conjunctiva with a characteristic pink that develops over the sclera along with a yellow discharge. But don't worry, it's easily treated with antibacterial eye drops. Unless your kids hate having eye drops put in their eye, then it might not be quite so easily treated. But don't give up. You're bigger, stronger, and smarter than they are. Maybe. Although we have been looking at the roots specific to the eye, there are also two suffixes unique to vision, opia and opsia. Both meaning vision, they can be seen in words like hyperopia or farsightedness and akinetopsia or an inability to see a moving object. And And now for a 10-second brain break. That's better. Continuing our discussion of the sensory system, we will now move from the eye to the ear. Did you know that ears are completely individual, just like fingerprints? They are! Some people have even explored technology that would unlock a cell phone when held to the ear, just by recognizing its unique pattern. Fun! The main purpose of the ear is hearing. What? Hearing. What? I said the main purpose of the ear is hearing. Oh, you heard me the first time. The ears collect sound waves, which in turn vibrate structures within the ear. The vibrations are changed into electrical signals within nerves. The acoustic nerve sends these electrical signals to the brain. The brain interprets these signals as sound. Ta-da! The ear itself can be subdivided into the outer, middle, and inner ear. We will look at the main components of each of the subdivisions next. The outer ear includes the pinna and the ear canal. The pinna is what most people think of when they think about the ear, the fleshy outside portion, which sits on the mastoid bone of the skull. The pinna is shaped like a funnel, which helps collect sounds from the ear and send them down through the ear canal. Round and around they go into the middle ear. Speaking of cleaning your ears, cerumino is the word root for earwax, and cerumen is the medical term for earwax, like this little treat that someone removed from an ear. The tympanic membrane, or eardrum, separates the outer ear from the middle ear. The word roots associated with the tympanic membrane are tympango and moringo. Has anybody else ever seen or experienced a ruptured eardrum? I have. A perforated eardrum may be caused by loud sounds, a foreign object in the ear, head trauma, a middle ear infection, or rapid pressure changes, such as from air travel. Symptoms include sharp ear pain that subsides quickly, drainage, ringing in the ear, or hearing loss. The condition usually heals on its own within a few weeks. Mine did. The middle ear is a hollow space between the outer and inner ear. It contains 3 tiny bones known as the auditory ossicles that carry the vibration of the tympanic membrane to the inner ear. The malleus, incus, and stapes are also called the hammer, anvil, and stirrup because of their shape. It's a nickname. The inner ear begins with the entrance to the cochlea. The cochlea is a bony shell filled with fluid and hair. When sound waves are transferred to the fluid within the cochlea, the fluid moves and vibrates tiny hairs attached to a membrane. The tiny hairs vibrate, creating electrical signals that then travel down the acoustic nerve to the brain. The cochlea is also called the snail because it looks like a door. Just kidding, looks like a snail. The inner ear is also involved in the interpretation of balance and direction as part of the vestibular system. Vestibulo literally means a vestibule or entryway. Here, the vestibule is a small area in front of the semicircular canals which help regulate balance. These semicircular canals are filled with fluid and hair. Unlike in the cochlea, the hairs in the vestibular system are moved by movement and head angle rather than sound. This allows them to send information to the brain about the tilt, rotation, and motion of the head as well as your orientation in space. It also allows the brain to coordinate movement with the eyes. Because the hairs in your inner ear respond to gravitational pull, your vestibular system can also help orient you to gravity. This can become particularly important if you're ever caught in an avalanche. We get a lot of those here in hot, humid Houston. Theoretically, though, if you remain calm when trapped beneath a mountain of snow, your inner ear will help you determine which way is up so that you don't accidentally dig yourself into an even deeper hole. As with all good things, this lecture too must come to an end. Thanks for exploring introductory terms and roots related to the sensory system with me. See you next time. Yay! You came back. In this lecture, we will discuss some common medical terms related to the sensory system that you might find in the subjective portion of an ophthalmology, optometry, or otolaryngology note. Recall that subjective terms are those that the patient reports to the healthcare provider. They are the reason why the patient wants to see the specialist. Most often, patients will come in complaining of a change in vision. Here are some other common eye complaints that might also bring someone to the ophthalmology or optometry clinic. Remember, these terms are not a particular diagnosis in themselves, but rather symptoms used to generate a forthcoming diagnosis. One change in vision that might cause someone to visit the ophthalmologist is amblyopia or diplopia, better known as double vision. This might be a sign of an underlying disease or a result of putting external pressure on one eye, having the wrong eyeglass prescription, or extreme fatigue. Or it could just mean you're looking at identical twins. Other vision complaints might include an inability to see things up close. This condition is also known as hyperopia or farsightedness. The opposite is myopia, or nearsightedness, or an inability to see things that are further away. Both conditions are usually easily remedied with corrective lenses. You might have heard older people complain about their vision. Farsightedness usually becomes noticeable in the early to mid-40s and worsens until around age 65. Symptoms include a need to hold reading material at arm's length to make letters clearer, blurred vision at normal reading distance, and eye strain after reading. A blepharospasm is an involuntary contraction of the eyelid, perhaps more commonly known as an eye twitch. Fatigue, sleep deprivation, or prolonged screen time can all cause benign blepharospasms. For some people, this might trigger a blepharospasm. Or this. But definitely this. Seriously, just wait. Parenting is like one big blepharospasm. I mean, unsurpassed joy. I digress. Back to the lecture. Other complaints might relate to the tear glands, like watery eyes. The medical term for excessive tearing is dacryorrhea. Wait, dacryo what? Dacryorrhea. There's our favorite suffix again. The opposite of dacryorrhea is xerophthalmia, or dry eyes. Our final complaint related to the eye is ophthalmalgia. A general term for pain in the eye, it can be caused by many factors including trauma or infection, or poking yourself in the eye. Don't do that. And now for a 10-second brain break. From the eye, we move to the ear. Changes in hearing are the most common complaints regarding the ear. Other common complaints might include ear pain or changes in balance. Here are a few more specific complaints that might take someone to the otolaryngologist. Fun fact! Sitting in front of the speakers at a rock concert can expose you to 120 decibels, which will begin to damage your hearing in only 7.5 minutes. Good thing your favorite jam is only 7 minutes and 29 seconds. Hyperacusis, or excessively sensitive hearing, is a hearing disorder that makes it hard to deal with everyday sounds. You might also hear it called sound or noise sensitivity. If you have it, certain sounds may seem unbearably loud, even though other people barely seem to notice them. Shh! I bet the whole world seems unbearably loud to librarians. I wonder if they have developmental hyperacusis. The opposite of hyperacusis is hypoacusis, or excessively insensitive hearing. It can occur unilaterally when it affects one ear or bilaterally when it affects both. I think this happens with moms. Have you ever noticed how their kids can annoy the mess out of you with all their noise while their own mom seems to hear nothing? It's when things start to get quiet that moms worry. Sometimes hearing loss is a natural part of the aging process. This hypoacusis due to old age is called presbycusis. Wait, is anyone else hearing that? That ringing sound? Oh, I forgot to silence my phone. Phew! For a second, I thought my tinnitus was acting up again. Tinnitus is a ringing in the ear that can be caused by exposure to loud sounds, whiplash, head injuries, too much earwax, or even medication side effects. Finally, some complaints might be related to balance. Vertigo is the sensation that you are moving or spinning when in actuality, you're not. This feeling may be barely noticeable, or it may be so severe that you find it difficult to keep your balance and do everyday tasks. If you've ever had vertigo, it is a most unpleasant sensation and can also cause nausea and vomiting. Of note, vertigo can be a symptom of an underlying vestibular disorder, and vestibular physical therapy can help. I got to observe this process a few times as a student. When they told me to ready the puke bucket for the treatment, I thought I might need my own, but it really can help. As with all good things, this lecture too must come to an end. Thanks for exploring subjective terms related to the sensory system with me. See you next time. Once again, I greet you and bid you welcome to Medical Terminology. In this lecture, we will discuss some common medical terms related to the sensory system that you might find in the objective portion of a clinic note. Recall that objective terms are those that the practitioner will observe or discover through labs and tests. They are used to describe what the specialist finds in their examination. This particular examination is revealing an excessive amount of hair in the ear. Oh wait, that's not a human. Good eye, doc. The visual examination of the eye is performed first in a systematic manner. It will include the eyelids and the eye itself. Specialized tools can be used for further inspection. Let's see what these examinations might reveal about the eye. Before we take a closer look at exam findings, let's first talk about the examiners. We have been tossing around two terms for specialists in the vision portion of the sensory system, ophthalmologist and optometrist. Are they interchangeable? No! An ophthalmologist is a medical doctor who can perform medical and surgical interventions for eye conditions. An optometrist is an eye doctor that can examine, diagnose, and treat your eyes. Usually, patients start at the optometrist, who then refers them to an ophthalmologist if necessary. In order to do their examinations, special doctors need special tools. An ophthalmoscope and retinoscope are instruments for viewing the eye and retina respectively. Another device to examine the eye, a tonometer, measures intraocular pressure. This test is particularly useful in diagnosing glaucoma. If you've ever been to the optometrist, it's that little machine that blows a puff of air at your eye. It always startles me, even though I know it's coming. Kind of like that. How's your heart rate and rhythm? Moving on to observations a practitioner might make about the eye, lacrimation requires no specialized examination tools. You can visually see the tears forming. Unless you are showing animal cruelty prevention commercials on loop or have animal dander and pollen pumped in through your air ducts, it's probably not normal for your patients to tear up in your office. Lacrimation leads to the watery eyes commonly seen in allergies, infections, and clogged tear ducts, which would normally drain the tears. Another visible finding on an eye exam is blepharoptosis, or drooping of the eyelid. Fun fact, I also have blepharoptosis, but only in the right eye. You can see it when I smile like this. It gets even worse when I'm tired or haven't slept well. So take a look. How am I doing today? Now you can't look away, can you? You're gonna check every lecture, which is okay, but don't let it make you miss all the riveting content we're covering. Exophthalmos is a bulging or protrusion of the eyes out of the socket. This condition is commonly associated with disorders that result in hyperthyroidism, like Graves' disease. You don't necessarily need to know that, but I threw it out there in case it stuck. You're welcome. What you do need to know is that exophthalmos is a bulging or protrusion of the eyes out of the eye socket. Nystagmus is an involuntary back and forth movement of the eyes. It can be a genetic disorder, a sign of an underlying neurological issue, or a side effect of alcohol intoxication. Of note, nystagmus occurs normally with travel at high rates of speed, like in a car, bus, or train. Next time you're riding with another passenger, lean over and awkwardly stare at their eyes while they watch the passing scenery. Fun way to make new friends! Or get slugged, so maybe not, but it's all for educational purposes. Nystagmus in action. Strabismus is when the eyes go in different directions while looking or focusing on the same object. Causes of strabismus can include nerve injury or dysfunction of the muscles controlling the eye. The condition more commonly called cross-eyed is also strabismus. You know when the doctor asks you to follow the pen with your eyes and then brings it in way too close to your nose for comfort? Yep, that can check for strabismus. All that talk about eye issues is putting my hypochondriac tendencies in overdrive. I can literally feel my eyes. To reset, let's cover our eyes and give them 20 seconds of rest from the screen and all the previous images now floating around in your head. Try it now. As with the eye, the examination of the ear starts with a visual examination of the outer part of the ear for redness and swelling. The ear canal is also examined for redness and swelling, as well as abnormalities of the cerumen, or earwax. Yum. Before we take a closer look at the exam findings, let's first talk about the examiners for the ears as we did with the eyes. So far, we have referred only to otolaryngologists. Although the name only refers to the ear and throat as in otto and laryngo, these doctors specialize in ear, nose, and throat disorders and are more commonly called ENTs. Audiologists, on the other hand, are specialists in hearing. They administer hearing tests to check function of the sensory system. Remember the beep test from the school screenings? With the funky headphones and beeps in different frequencies? In case you don't, here you go. You will hear a series of beeps. Please raise your hand when you hear the sound. Ready? Begin. So, how did you do on that screening test? There were 2,342 beeps, so if you raised your hand less than 2,342 times, you might want to get that checked out. Just kidding, there were only 2,341 beeps. To examine the ear, an otolaryngologist will probably use an otoscope. I'm sure you've all had the experience of having an otoscope in your ear before, you just didn't know what it was called, but now you do. Aren't you glad you're taking this course? Next time the doctor puts one in your ear, yell, "Otoscope!" and see what happens. No, don't. Remember that hearing screen audiologists use? It's done using an instrument called an audiometer, which produces a record of your hearing called an audiogram. Now that we've covered the exams and instruments for examining the ear, let's finish by looking at a few abnormal findings. Our first appetizing abnormal finding is ceruminosis, or excessive formation of cerumen or earwax. Fun fact! People have tried to find a purpose for the excessive earwax produced in ceruminosis, like using the wax to make candles. Didn't work. Clean your ears. Throw the cerumen away. Our next abnormal finding is otopyorrhea. Wait. Otopio what? Otopyorrhea. This word combines two of my favorite word parts, pio meaning pus and rhea meaning flow. Add in oto and you get a flow of pus from the ear. But seriously, this is not normal. So if you get one, go to the doctor. Our final abnormal finding is a tear or hole in the tympanic membrane. Tympanic perforation, or a ruptured eardrum, usually causes an immediate relief of pain as the pressure behind the membrane is relieved and the air, fluid, blood, or pus drains out. As with all good things, this lecture too must come to an end. Thanks for exploring objective terms related to the sensory system with me. See you next time. Welcome. Thanks for joining me today. In this lecture, we will discuss some common medical terms related to the sensory system that you might find in the assessment portion of a clinic note. Recall that assessment terms are the diagnosis or differential diagnoses that the practitioner has decided upon after careful assessment of the subjective patient report and objective findings. They describe the diagnosis of the condition. This patient is obviously having an exam of the ear canal, or that's just a really convincing screensaver. Diagnosis of an eye condition is made according to its location. First, let's learn a couple of words that mean eye disease, oculopathy and ophthalmopathy. Please note that these are general terms for a disease of the eye. Another specific diagnosis of the outer eye, corneal abrasion, is the medical term for a scratch on the cornea. You can see it pictured here in the pale green area indicated by the arrow. Corneal abrasions are incredibly painful and lead to immediate lacrimation and even blepharospasm as the body tries to protect and heal the eye. And now for story time with Kabiri. Once upon a time, there lived a teenage boy. Like many boys his age, he struggled with acne vulgaris. Unlike many boys his age, he also wore hard contact lenses to correct myopia and severe astigmatism. One day, he was cleaning his acne with an abrasive skin cleanser. When he finished scrubbing for the morning, he decided to insert his contact lenses without washing his hands first. The residue from the abrasive skin cleanser became trapped between his cornea and his contact. Although his eyes felt a bit irritated, he went to school, but each time he blinked, scratch, scratch, scratch. Over the course of the day, the corneal abrasion continued to worsen to the point that his eyelids seized up and he could no longer see. The eye doctor was unable to remove the contact lens, which became lodged behind his eyeball. After days on the couch with warm compresses and pain medication, his cornea finally healed. So, wash your hands or you'll get a corneal abrasion. The end. A cataract is an opacity or cloudiness of the lens of the eye. They usually happen slowly over time and are therefore most common in older age. In humans, the cloudy lens can be replaced with a clear artificial lens. The dog shown here still has cataracts in place. Do they have doggy cataract surgery? The main symptom of cataracts is blurry vision, described as looking through a foggy window. Cataract surgery is generally a simple, safe outpatient procedure. Moving on, glaucoma is an eye disease that causes damage to the optic nerve, resulting in vision loss. Damage to the nerve is usually caused by a buildup of pressure in the eye. Vision loss is slow but steady. Treatment includes eye drops, medications, and surgery. Another interlayer eye condition involves the retina. A retinopathy is a disease of the retina caused by damage to the blood vessels and the tissue at the back of the eye. More specifically, diabetic retinopathy is caused by damage to the blood vessels from poorly controlled blood sugar. Early symptoms include floaters, blurriness, dark areas of vision, and difficulty discerning colors. If left untreated by blood sugar control, laser treatment, or surgery, retinopathy can lead to complete blindness. And on that note, we end our discussion of assessment terms related to the eye. And now for a 10-second brain break. Like the eye, diagnosis of ear conditions is also made according to location. The ear canal and cerumen would be the outer ear, the ossicles and tympanic membrane the middle ear, and the cochlea and labyrinth the inner ear. But first, a warm fuzzy. Aww. From that cute picture to this one, our first ear diagnosis is otomycosis, or a fungal infection of the ear. Pictured here in the otoscope, fungus can actually grow inside the ear and must be removed. Keep those ears squeaky clean, people, or things will grow in there. Maybe not the watermelon seed my mom warned me about sticking in my ear as a kid, but still. Now for one of the most common ear diagnoses, otitis media. Otitis media is the medical terminology for inflammation of the middle ear or an ear infection. Otitis media symptoms include ear pain and even fever. Not so fun fact, 76 to 95% of all children will have otitis media before age 6. And if you've ever had one, you know they are no fun. No fun at all. Sorry, little buddy. I would like to finish this lecture by looking at two types of hearing loss, conductive and sensory neural. Conductive hearing loss is caused by a physical blocking of sound waves through the ear. This can be caused by something as simple as a buildup of cerumen. Blocking sound waves from reaching the middle or inner ear is also the premise behind earplugs. Just think of them as temporary and purposeful conductive hearing loss, especially useful to drown out your roommate snoring or your med-term professor droning on. Unlike conductive hearing loss, the sound waves are transmitted to the inner ear in sensory neural hearing loss. However, they are not processed correctly or are blocked from being transmitted from the inner ear to the brain. Sensory neural hearing loss can be much more complicated than conductive hearing loss and is usually related to an underlying neurological issue, as its name implies. As with all good things, this lecture too must come to an end. Thanks for exploring assessment terms related to the sensory system with me. See you next time. Well, hello again. In this lecture, we will discuss some common medical terms related to the sensory system that you might find in the plan portion of a clinic note. Recall that plan terms refer to the treatment or therapy that the practitioner has decided will best address the diagnosis from the assessment section. Sometimes the plan may also include further testing to rule out differential diagnoses or referrals to other practitioners to assist in clarifying an unknown diagnosis. Or in this case, the plan might include a big surprise. Surprise! Just kidding. Don't trust a plan that makes a doctor look like this. We will start out by looking at medications and treatments used to treat disorders of the eye and ear. Our first eye medication is a mydriatic. A mydriatic is a drug that causes abnormal dilation of the pupil. Usually, these medications are delivered as eye drops during an eye exam to allow the practitioner to see the retina and other deep tissues of the eye. They are also the reason your eyes are so sensitive to light when you leave the eye doctor until the effects wear off. Ouch! My retinas are burning! The next medication for the eye is intravitreal antibiotics. Yes, that's a syringe. Yes, it goes into your eye. Syringe plus eye equals intravitreal antibiotics. They are commonly used to treat age-related macular degeneration and other diseases of the retina and allow for direct delivery and absorption of the medication by the eye. Just don't watch. From the eye, we move to medications and treatments for the ear. I hope you're listening. Get it? Listening? An auditory prosthesis is more commonly known as a hearing aid. These devices come in a wide variety of shapes and sizes, and the technology improves every day. They are commonly used to treat hearing loss like presbycusis. And now for an ear medication. Sometimes cerumen can become impacted and impair hearing, as in conductive hearing loss. If there is a heavy buildup of earwax, you might need cerumenolysis, or a breakdown of the earwax. Cerumenolysis is accomplished using a cerumenolytic, or a drug that aids in the breakdown of earwax as seen here. The final ear medication is not a medication itself, but rather a class of medications that can cause deafness. Ototoxic drugs damage the ear and can lead to hearing loss. Some antibiotics and chemotherapy drugs fit in this category. Time to give our brains a break. Enjoy this musical interlude while you do so. Welcome back. Beyond medications, sometimes surgery will better address common disorders of the eye and ear. When someone has a cataract, the old lens must first be removed in order to replace it and clear their vision. The process of breaking up an existing lens for removal is called phacoemulsification. Use that in a sentence at dinner tonight. After phacoemulsification and removal is complete, the surgeon can then perform an intraocular lens implant where a shiny new lens is placed. Fog lifted! Sometimes a diagnosis like cancer will require the removal of an eye. Enucleation or ophthalmectomy means removal of an eye. However, enucleation can also become necessary after an eye is removed from the socket due to trauma. This is particularly common in dogs with short noses and shallow eye sockets like Shih Tzu, Pekingese, Pug, and Boston Terrier. Yes, I said pug. No wonder this one looks a bit scared. I'm sure you'll be okay. Just go easy. If a retina becomes detached, you might need a retinopexy to surgically reattach it. Reattaching a detached retina can restore vision. Certain types of retinopexy procedures can even be done in the practitioner's office. Cool! You might know that LASIK is a surgery to permanently correct visual deficits like hyperopia and myopia. But did you know that it was also an acronym? I know! Do the fun facts never end? LASIK stands for Laser-Assisted In Situ Keratomy Lucis. No wonder they call it LASIK. Our final surgery or procedure related to the eye is blepharoplasty. Blepharoplasty can be done for medical or cosmetic reasons and is the surgical reconstruction of the eyelid. Do you know what the procedure is commonly known as? An eye lift. How uplifting. To complete this lecture, we also need to look at the surgical options and procedures for the ear. Should a patient experience a tympanic perforation that is not healing, they can undergo a maryngoplasty or tympanoplasty. Both mean surgical repair of the tympanic membrane or eardrum. The other surgical option I would like to discuss is a cochlear implant. Recall that the cochlea is involved in producing nerve impulses that are sent to the brain for interpretation. In some types of sensory neural hearing loss, the cochlea does not work properly. A cochlear implant can electrically stimulate the cochlear nerve as an alternative. One part sits behind the ear and picks up sounds with the microphone. It sends this information to the internal part of the implant placed just under the skin behind the ear. A thin wire sends signals to the cochlear nerve, effectively bypassing the cochlea, and sends sound information to the brain to produce a hearing sensation. Amazing, right? Although the sense of hearing is not what people without sensory neural hearing loss would hear, better communication and awareness of sound is possible with appropriate therapy and practice. As with all good things, this lecture too must come to an end. Thanks for exploring play and terms related to the sensory system with me. See you next time. Salutations! Glad you're here. In this lecture, we will continue our exploration of medical terminology as it relates to the digestive system. Let's get started. The digestive system, also known as the gastrointestinal system, is responsible for taking in and breaking down food for energy. Through digestion and absorption, this system makes sure we harvest every possible benefit from our diet. Fun fact, the average adult makes around 2 pints of saliva a day. That's 2 16-ounce water bottles full. Wow! Let's begin by looking at the basic purposes and anatomy of the digestive system. But first, let's look at this adorable little bunny. Aww. The first purpose of the digestive system is digestion. Digestion is the process of breaking down food into its component parts. This is accomplished through mechanical digestion, like chewing and the turning of the stomach, as well as chemical digestion through the use of enzymes. This giraffe is demonstrating some mad chewing skills on that tree. The next task of the digestive system is to absorb the nutrients from the food that has been digested into its teeny tiny component parts. This occurs predominantly in the small intestine. Absorption also includes harvesting water content and anything else that might be beneficial to the body. Just like a sponge soaks up spills, the digestive system soaks up water and nutrients. The gastrointestinal or GI tract is the main part of the digestive system. The GI tract includes the mouth, esophagus, stomach, and intestines. Together they form essentially one long tube or hose from mouth to anus. That's food for thought. Along with the GI tract, there are also accessory organs in the digestive system like the liver, pancreas, and gallbladder. These organs contribute to the digestive process, usually by secreting special enzymes needed to break down food. The mouth is the first part of the digestive system. Here, chewing or mastication breaks down food into smaller pieces to increase the surface area exposed to digestive enzymes. From there, it goes down the esophagus into the stomach. Using mechanical and chemical digestion, the stomach continues to break down food into its component parts. After food has finished the digestion process in the stomach, it is called chyme. Not chyme, as in the thing pictured here, but chyme. Chyme has a paste-like consistency and is gradually squirted into the small intestine. Chyme. From the stomach, the food continues as chyme into the small intestine. Here, the digestive process is finished and absorption of nutrients occurs. By the time the food reaches the large intestine, it is mostly water and indigestible food products like fiber and corn. Oh, corn. Everyone has seen it go in and seen it come out. So is corn digestible? Yes? No? I don't know. The answer is yes, but only if you break the kernel. That high fiber covering on the corn kernel prevents it from being digested. But if you chew your corn, your body can harvest the nutrition inside the kernel and you will never see it again. And now for a 10-second brain break. Welcome back. In the previous section, we focused on the basic purpose and anatomy of the digestive system. We will now begin to learn some new word roots related to the same. Up first, some general terms. Abdomino, celio, and laparo all mean abdomen. You can see them in words like abdominal, celiac disease, and laparoscopic. I don't know about you, but my abdomen looks exactly like the one in the photo. Yep, I'm ripped. Hepato and hepatico both mean liver. You can see them in words like hepatitis, which is a viral inflammation of the liver. Meaning pancreas, pancreato is the root in the word pancreatitis, which is obviously an itis of the pancreas. I always think that the anatomical drawings of the pancreas resemble those little baby corns I get in my veggie lo mein. That's why I eat around them. The roots oro and stomato both mean mouth or your pie hole. Oro is far more commonly used and can be seen in the word oral, meaning pertaining to the mouth. In order to optimally chew solid food, you need teeth. Dento and odonto both mean tooth. You can see them in words like dental and orthodontist. The tongue plays a role in speech, but also in chewing and swallowing your food for digestion, and apparently in taking selfies on a scooter. The roots glosso and linguo mean tongue. They can be found in the words hypoglossal and sublingual. Fun fact, did you know giraffes have purple tongues to avoid getting a sunburn? Wow. The darker pigment helps protect their tongues from roasting in the sun as they spend all day using it to grab leaves off of the trees. Cool. Esophago means esophagus and can be seen in the word esophageal cancer. So why is there a picture of a wet slide on this slide? Because I think of the esophagus as a glorified slide delivering food from mouth to stomach. Whee! The root gastro means stomach. You can see it in the word gastritis, which is an inflammation of the stomach. Entero means intestine. It can be seen in the word gastroenteritis, which is an inflammation of the stomach and intestines. Or another way to say your digestive system is angry. Why the picture of sausages? The natural casing used to make them is actually animal intestine. You're welcome. The duodenum, jejunum, and ileum are subdivisions of the small intestine in order from start to finish. The word roots duodeno, jejuno, and ilio are used for them respectively. See the small sausages being cased in small intestines? The roots colo and colono both mean colon. Colon is another term for your large intestine. They can be seen in words like colorectal cancer screen and colonoscopy, which are both super fun tests you have to look forward to in your older age. The word root for rectum is recto. The rectum is the end of the GI tract. Want to hear a joke? Why can't you drive nice cars? Because you wrecked them. The anus is the external opening at the end of the digestive system, and its word root is ano. This is Uranus, the planet. Finally, procto is the medical term that refers to both the rectum and the anus. You can see it in the word proctologist, which is a specialist in the rectum and anus pictured here, and looking way too happy. As with all good things, this lecture too must come to an end. Thanks for exploring introductory terms and roots related to the digestive system with me. See you next time. Welcome, I'm glad you're here. In this lecture, we will discuss some common medical terms related to the digestive system that you might find in the subjective portion of a clinic note. Recall the subjective section contains things the patient reports. Patients will have complaints that can usually be categorized into problems with either pain or function of the digestive system. Common digestive system complaints include pain. Here are a few commonly reported pain-related digestive complaints. The first pain-related subjective complaint is stomatodynia, or pain in the mouth. This might be from any number of things, including ulcers as shown here. Anybody else get those? Not pleasant. The next medical terms, dentalgia, odontalgia, and odontodynia mean pain in the tooth or a toothache. Esophagalgia is the medical term for pain in the esophagus. This condition is commonly caused by acid reflux or heartburn as the stomach acid gets pushed back up into the esophagus. Sometimes esophagalgia can become so severe that people attribute it to a heart attack rather than reflux. What? Gastralgia and gastrodynia both mean pain in the stomach, more commonly known as a stomachache. If the pain is in the intestines, patients might come in complaining about enterodynia. Intestinal cramping from eating contaminated food or food that does not agree with you is a common cause of enterodynia. Another common complaint related to the digestive system is related to the accessory organ known as the gallbladder. Cholecystalgia is the medical term for gallbladder pain. Usually this is caused by the buildup of gallstones, which can block the ducts leaving the organ and cause intense pain. Hemorrhoids are the result of abdominal straining, which causes the veins around the anus to become inflamed and swollen. They are common side effects of natural childbirth and constipation, and they can make you feel like you're sitting on one of these.
Ouch!
And now for a 10-second brain break. In addition to these common complaints, some patients may complain about the function, or rather dysfunction, of the digestive system. Sometimes you don't know what you've got until it's gone. Aphasia is a medical term that means not eating. Aphasia can happen due to loss of appetite, pain in the mouth or GI tract, or just from being a picky toddler. In the elderly, stomatodynia and dentalgia are often cause for aphasia. The medical term for digestion, dyspepsia, means bad digestion or an upset stomach. It can be caused by many different things, some of which may include an underlying digestive disease. Haven't we all been there? The medical term for vomiting or throwing up is emesis. It's actually a normal protective reflex to protect you from further digesting contaminated food or drink. Of course, it can also happen with motion sickness, emotional distress, or because you're witnessing someone else vomiting. In the hospital, those little kidney bean-shaped plastic dishes are called emesis basins. I much prefer the tube-shaped plastic bags you can seal off. I keep a few in my car. Why? Because once I had to use my good covered dish for a scene like this in my back seat. Never again. While emesis is a normal protective reflex, hematemesis, or vomiting blood, is never normal. Immediate medical attention should be sought for hematemesis. Also related to emesis, hyperemesis is the medical term for excessive vomiting. This is particularly common with pregnancy and is sometimes called morning sickness or all day and night sickness. I had hyperemesis. It was great. Not really, but it was worth it so far. Okay, we all knew it was coming. The Rhea of all Rheas, diarrhea. You can't have a lecture on the digestive system complaints without it. A common malady, diarrhea, means loose stools. If the diarrhea is a result of an infection and also contains blood and mucus, you might have dysentery. Regular old diarrhea results from the food spending too little time in the large intestine, which prevents all the water from being absorbed, thus loose, runny stools. It usually passes on its own. Get it? The opposite of diarrhea is constipation or difficulty passing stools. You can literally sit there all day and that poop is not going into the toilet. Look at it just smiling and mocking us. With constipation, the digested food remains in the large intestine too long and dries out as all the water is absorbed. This results in feces that is rock hard and dry, making it much more difficult to pass. Some medications, especially pain medications, a low-fiber diet, and lack of physical activity can all cause constipation. Finally, a bowel obstruction or obstipation is a blockage in the GI tract. This is a serious medical condition that prevents food from moving through the digestive system as it should. One symptom of obstruction is emesis, as the food has nowhere else to go but up. Blockages can be partial or total and can lead to intestinal rupture, which is a life-threatening condition. Finally, I would like to conclude this lecture with a subjective digestive system term that just might come in handy should you find yourself trying to avoid a particularly sticky situation. These terms are being provided for educational purposes only and used for personal gain, either real or imagined. It's not being endorsed by this professor, this department, this university, or any of their affiliates. Use at your own risk. Our ominous sounding disorder is sialorrhea, as in, I'm sorry, sweetheart, I would love to go try that new Asian, Caribbean, Mexican, Italian, Persian fusion restaurant, but you know that new foods give me sialorrhea. Why don't you take your friends instead? And the best part is, it's probably true. Food and the thought of food can bring on excessive salivation. Yep, the good old sialorrhea excuse should ensure you were able to say sayonara to heartburn and indigestion and hello to a quiet evening at home. As with all good things, this lecture too must come to an end. Thanks for exploring subjective terms related to the digestive system with me. See you next time. Welcome. Look at us, all ready to learn some common medical terms related to the digestive system that you might find in the objective portion of a healthcare record. Let's do it. Recall that objective terms are those that the practitioner will observe or discover through labs or tests. They are used to describe what they find in their examination. With the digestive system, this might mean visual inspection, labs, and imaging tests. Physical findings related to the digestive system may include the following medical terms. Before we get too far into our discussion, you should be familiar with the 9 anatomical regions of the abdomen. As shown here, if you were to draw a tic-tac-toe game on your belly, it would divide you into roughly 9 equal regions. The epigastric, umbilical, and hypogastric regions run in the middle, with the right and left hypochondriac, lumbar, and inguinal regions flanking them. These terms are particularly important in identifying pain location, as it can help determine the source based upon organ location. Gingivitis is an inflammation of the gums. It can be caused by bacteria or other accumulations on the teeth. Regular personal and professional oral hygiene can help prevent and treat the disease before it progresses to loss of teeth. So brush and floss twice a day, every day. Okay, stop yelling! The medical term for breaking a tooth is odontoclasis. This is usually related to mouth trauma like getting hit in the teeth with a flying hockey puck or falling on your face while trying to ice skate. If you're lucky, it's a baby tooth and was going to fall out anyway. If you're unlucky, you will need professional cosmetic dentistry to fix it. Or just leave it. No judgment. Sometimes a healthcare practitioner will use their stethoscope to listen to the abdomen to check for bowel sounds. Gastroparesis is a partial paralysis of the stomach, which prevents it from moving and turning as it should. It also cannot empty itself, resulting in the characteristic symptom of nausea and emesis. Gastroparesis can be caused by infection, some medications, and nerve damage from prolonged diabetes. Abdominal ascites is a buildup of fluid in the peritoneum of the abdomen. It causes the classic pot belly look where the abdomen protrudes. This is particularly common in malnutrition and hunger, where an otherwise dangerously thin person has a round, protruding belly. Ascites is also associated with diseases like digestive cancers. A hernia is a general term for when an organ ruptures or protrudes through the wall, which normally holds it in place. Intestinal hernias are particularly common and tend to protrude through the abdominal wall. You can usually feel them pop out when you contract your abdominal muscles and can sometimes even push them back in. Most hernias are not an immediate emergency, but they also do not resolve on their own. Surgical repair may be necessary in some cases. Most hernias are caused by muscle weakness or strain. Like trying to move your own furniture. Physics, people. Get yourself a cheap set of floor sliders to decrease friction, or pay movers, or buy lighter furniture like bean bags. So many hernia-saving options. Steatorrhea is a condition where you have excessive fat in your feces. It is usually caused by malabsorption as a result of an underlying digestive disorder. You may see your daily deposits float like this bobber in the toilet water, and sometimes those floaters may be harder to flush. Steatorrhea can also be a dietary issue, which is much more easily resolved and temporary. So don't panic if you have floaters every once in a while, but if it happens on a regular basis, is accompanied by other digestive issues, or is severe, tell your doctor. Now for a really useful medical term related to the digestive system. Anophony is a general term for any sound from the anus, like a fart or flatus, which is the medical term for passing gas. Fun fact, did you know there are over 250 ways to say flatus in the English language? Breaking wind, letting Fluffy off the leash, cut the cheese, bottom burp, one cheek squeak, crop duster, bean blower. Need I go on? And no, those terms are not testable material, but anophony and flatus are. And now for a 10-second brain break. Don't move. From these terms, let's move to what doctors might find on labs and imaging for the digestive system. This first term deals not with a lab or image finding, but rather an instrument used to generate the image itself. A laparoscope is a general term for an instrument used to look inside, in this case, inside the abdomen. It also allows for investigation and even repair with minimal invasion, thus minimizing scars and risks. Sweet. Oh no, be careful, little one. There's a better way to see inside that dinosaur's esophagus, stomach, and duodenum. Just schedule them for an esophagogastroduodenoscopy. If you want to look inside the upper GI tract, you do an esophagogastroduodenoscopy. If you want to look inside the lower GI tract, you start from the other end and do a colonoscopy. A great way to view the colon, it is actually quite important in colon cancer screening. Starting at age 50, you should have one every 10 years if everything looks good, and more often if not. Preventative care, yeah! While this picture shows a big bowl of liver, hepatomegaly just means a big or enlarged liver. Bowl optional. Just kidding. I'm pretty sure this isn't human liver. Sometimes the bile that is made by the liver and stored in the gallbladder to help with the digestion of fats can consolidate or harden. When this happens inside the gallbladder, a colilith or gallstone is formed. They can cause pain in the gallbladder that is worse after a high-fat meal. Sorry, fried chicken livers. If the stone is in the pancreas, we call it a pancreatolith. Lith, stone. Pancreato, pancreas. Isn't med term nifty? Warning! Important public service announcement. If your stools are black and of a tarry consistency, you should seek immediate medical attention. Black tarry stools indicate blood in the stool and internal bleeding somewhere in the GI tract. However, not all blood is visible. A fecal occult blood test, or FOBT, checks a stool sample for non-visible blood. Visible and non-visible blood are never normal in stools. Finally, let's look at some other miscellaneous terms related to the digestive system. The term nasogastric tube refers to a tube inserted into the stomach via the nose. Remember that the nose is connected to the throat, which is connected to the esophagus, which is connected to the stomach. Did you connect all those dots? More commonly known as a feeding tube, NG tubes provide nutrition for patients who are unable to take food or liquids by mouth for a variety of reasons. Medical nutrition can then be delivered at a steady rate through the NG tube. Finally, our last med term related to the digestive system for this lecture is dentifrice. It's such a fancy word for toothpaste. Don't you just hate it when people squeeze the dentifrice from the center of the tube? Don't forget your travel-size dentifrice, and I only go to the dentist for the free dentifrice. What a useful word. As with all good things, this lecture too must come to an end. Thanks for exploring objective terms related to the digestive system with me. See you next time. Welcome! I'm so happy you're here. In this lecture, we will discuss some common medical terms related to the digestive system that you might find in the assessment portion of a clinic note. Terms associated with assessment are used when the healthcare provider has gathered the patient's subjective information and his or her objective information. With the digestive system, diagnoses are usually related to an infection or inflammation, dysfunction, or an abnormal structure. Our first group of digestive system assessment terms relate to an infection or inflammation. Let's take a look at some of the ones that are more commonly seen. But first, our daily dose of cuteness. Aww. Behold, a horse of the sea. Up first, gastritis. An inflammation of the stomach can be caused by a bacterial infection, excessive alcohol use, or even stress. Symptoms include gastralgia, dyspepsia, and nausea. Gastroenteritis is an inflammation not only of the stomach, but of the intestines as well. You can get it from trying to digest a blanket. How do I know? My lab mix tried it when I was in grad school. I came home to a condo full of bloody diarrhea, a vet bill I couldn't afford later. I learned the medical term for inflammation of the stomach and intestines, gastroenteritis. Cholecystitis is an inflammation of the gallbladder. It is usually caused by a gallstone. Commonly caused by a viral infection with the same name, hepatitis is an inflammation of the liver. Hepatitis A, B, C, D, and E are all types of viral hepatitis. However, hepatitis can also be the result of an autoimmune disease or drug and alcohol abuse. Pancreatitis is an inflammation of the pancreas. It might be acute with a sudden onset or chronic lasting over many years. Upper abdominal pain and steatorrhea are classic signs and symptoms. Gallstones are a usual cause. Diverticula are harmless pouches inside your intestines. If they become inflamed, you can develop diverticulitis, or an inflammation of the diverticula in the colon. You can also get this from trying to digest a blanket. Yep, same dog, same story. A type of inflammatory bowel disease, ulcerative colitis, is an inflammation of the colon along with the presence of ulcers. Diet and stress can aggravate ulcerative colitis, but the exact cause is unknown. Symptoms include diarrhea with blood or pus, rectal bleeding, and an urgency to defecate with or without success. And now for a 10-second brain break. All right, now that we've covered that, let's look at some diagnoses related specifically to dysfunction of the digestive system. This might get messy. Gastroesophageal reflux disease, or GERD for short, is a disorder characterized by the dysfunction of the lower esophageal sphincter between the esophagus and stomach. This dysfunctional sphincter allows acid from the stomach to flow backward up the esophagus. The acid can cause ulcers in the lining of the esophagus, causing the burning sensation. Also known as heartburn, GERD is a chronic but treatable disorder. Celiac disease, or gluten intolerance, is an autoimmune disease of the intestines due to an adverse reaction to gluten. Gluten is a protein found in grains like wheat, rye, and barley. Ingestion of gluten in people with celiac disease leads to damage to the small intestines. Often associated with excessive alcohol or medication abuse, cirrhosis is an extensive scarring of the liver. When the liver is damaged by disease or substance abuse, it attempts to repair itself and forms scar tissue in the process. Eventually, continued abuse leads to scarring so extreme that the liver can no longer function. As always, all things in moderation. You need that liver to last a lifetime. Sometimes, even though you eat, your body does not get enough nutrition. This can happen with malabsorption, an incomplete or lack of nutrient absorption by the intestines. This can be caused by numerous things, including a lack of digestive enzymes, bacteria or pathogens, or even accelerated movement through the intestines. Tapeworms and other parasites can also cause malabsorption. Obviously, the parasite eats the nutrients instead of the host. Can you believe people used to intentionally swallow tapeworms as a method of dieting? No thanks. Fun fact, this is not a picture of a tapeworm, it's a wormfish. Funner fact, the longest recorded lifespan of a tapeworm in a human is 35 years. Funnest fact, the longest recorded tapeworm from the human body was over 100 feet long, and the small and large intestine combined are only about 30 feet, so. Finally, let's take a look at a few new terms related to structural abnormalities of the digestive system. An overgrowth of the gums or tissue around the teeth is called gingival hyperplasia. It can be the result of poor oral hygiene or a medication side effect. Gummy smiles, normal and adorable in babies, not so much in adults. Esophageal cancer is a malignant tumor of the esophagus. Unexplained weight loss and painful or difficult swallowing can be signs and symptoms. Smoking and heavy alcohol use greatly increase the risk of developing esophageal carcinoma. Not looking so great for this person. Make better life choices. Much like the narrow rock formations have restricted the flow of this body of water, a narrowing of the sphincter between the stomach and small intestine restricts the movement of food and nutrition through the digestive system. Pyloric stenosis can be a congenital condition. It is found often in babies between birth and 6 months of age. Symptoms include vomiting and dehydration, but it is correctable with surgery. Colon cancer, or colorectal carcinoma, is a malignant tumor of the colon and rectum. Many times it develops from precancerous colon polyps that can be detected and removed before they become cancerous with a colonoscopy. Did I plug preventative care yet? Even the not so fun preventative care. Do it! As with all good things, this lecture too must come to an end. Thanks for exploring assessment terms related to the digestive system with me. See you next time. Welcome back. In this lecture, we will continue our exploration of medical terminology with a look at the male reproductive system. Here we go. Let's start with a look at the basic purpose of the male reproductive system. The main purpose of the male reproductive system is to allow for reproduction. It's nice that they named it for what it does. Thanks, anatomy system namers. As a reminder, the male reproductive system is charged with delivering the sperm to the egg. The 23 chromosomes from the sperm combine with the 23 chromosomes from the egg to make a whole new human. Amazing! Let's now have a look at the new word roots for the male reproductive system. The prostate is a walnut-sized gland in the male reproductive system. It produces fluid to nourish and protect sperm. The urethra actually runs through the center of the prostate due to its location between the bladder and the penis, much like the sprout running through the walnut shown here. Prostato is the word root for prostate. The penis is part of the external genitalia and serves as a passage for both the urinary and reproductive systems for urine and sperm, respectively. The word root for penis is balano. You can see it in words like balanorrhea. The roots orco, orchio, orchido, testo, testiculo all mean testicle or testy. The testicles are part of the external genitalia and serve as the sperm factories. They are housed external to the body to allow for a cooler environment more hospitable to sperm. Finally, sperm are the male reproductive cells made and housed in the testes. Spermo, spermato, and spermi are all roots meaning sperm. Fun fact! Sperm can live for up to 5 days in the female reproductive tract. Think about that for a minute. And now for a 10-second brain break. The following slides contain common complaints and observations regarding disorders of the male reproductive system. Sometimes the first symptom of an STD or sexually transmitted disease is ballonorrhea. Discharge from the penis is not normal and should be brought to the attention of a physician. Delaying medical intervention is not a good idea. It's better to talk about it. They've seen it all. Priapism is the medical term for a persistent and painful erection. Perhaps you've heard the disclaimers on medications for erectile dysfunction drugs asking you to seek medical attention if your erection lasts for over 4 hours. They are referring to priapism, and yes, you need to seek medical attention. And don't use any drug, particularly erectile dysfunction drugs, recreationally. Sheesh. Orchialgia and orchiodinea both mean pain in the oranges. The testes. This pain is terribly uncomfortable and debilitating and could be the result of a tumor, infection, or trauma, like getting hit by a baseball or the bat. Teaching your kids to play baseball can be hazardous to your health, or at least cause some serious orchialgia. Let's finish up with some common diagnoses and treatments for the urinary and male reproductive systems. In older age, it is common for the prostate to enlarge. This could be from prostate cancer or more commonly from benign prostate hyperplasia, or BPH for short. Symptoms of BPH include things like frequent urination, weak streams or starting and stopping, and an inability to completely empty the bladder. Remember, a portion of the urethra runs through the prostate, so as it enlarges, it constricts the flow of urine from the bladder. In other words, it takes your stream from this to this. But don't worry, BPH is treatable and benign, so that's just fine. Testosterone is the male sex hormone responsible for the development of secondary sex characteristics and behaviors. However, it can also be used as a medication. Perhaps you've heard of low T clinics. Low T refers to low levels of testosterone. They tout it can treat everything from weight gain to fatigue and lost muscle mass. Please remember that testosterone may be medically necessary for some conditions, but decreasing testosterone levels are normal as you age. Recall that BPH, or benign prostate hyperplasia, is an enlargement of the prostate that can compress the urethra. A transurethral resection of the prostate, or TURP, is a procedure to remove part or all of the prostate using the urethra for access. TURPs allow for a less invasive means of addressing the enlarged or diseased prostate and restore function. Super! Finally, a vasectomy is a procedure for removing part of the vas deferens, or the tube that carries sperm from the testes into the ejaculation duct. Also a male sterilization procedure, the disruption in sperm transportation prevents fertilization without affecting the appearance of the genitalia, ejaculate, or sexual function. In fact, no one would know unless you told them. It's a safe, quick, and over 99% effective way of preventing pregnancy, as long as you do the follow-up visit to make sure your swimmers are a no-show for the swim meet. And now, you can even do the follow-up testing in the comfort and convenience of your own home. How much easier could it be? As with all good things, this lecture too must come to an end. Thanks for exploring introductory terms, word roots, and SOAP terms related to the male reproductive system with me. See you next time. Welcome back. In this lecture, we will explore medical terminology for the female reproductive system. Perhaps you've heard of obstetrics and gynecology, or an OB-GYN. Obstetrics deals with the female reproductive system related to pregnancy, and gynecology addresses all other issues of the female reproductive system. We will start with the gynecology terms. Let's go. Let's begin with a look at the basic purpose, anatomy, and new word roots for the female reproductive system as it relates to gynecology. As with the male reproductive system, the primary purpose of the female reproductive system is reproduction. This little person looks quite surprised by that fact, but they wouldn't be here without it, or maybe they're still traumatized by the delivery process. Whoa, man, did you know that gyneco and gyno both mean whoa, man? If not, you do now. You can see them in words like gynecologist, which is of course a specialist in the female reproductive system. Minnow is the root for menstruation, or the monthly cycle of uterine shedding. It is also sometimes called a period, as pictured here. My husband once told me to turn it into an exclamation point. That did not go over well. Masto and mammo both mean breast. Of note, these are not sex-specific terms, as the same roots and words apply to all humans, and really all mammals. Do you hear mammo in the word mammal? I do. The roots ovario and oophorio both mean ovary. Ovaries are the female reproductive organs responsible for the eggs or female reproductive cells. Fun fact, Did you know that the ovary of a plant will develop into its fruit, enclosing its own seed? So I suppose this apple is the ovary of the apple tree. Neat. Salpingo means fallopian tube. The fallopian tubes receive the ovulated egg from the ovaries and have long finger-like projections to capture the released egg. They remind me of the sea anemone. Come to me, my pretty. The uterus, also known as the womb, is represented by the word roots hystero, metro, and utero. The uterus is the part of the female reproductive system that holds the fetus during pregnancy and swells with fetal growth. This one looks pretty happy. When not pregnant, the uterus continues to prepare every month just in case by building up a lining that is shed during menstruation if fertilization does not occur. The cervix is the opening at the bottom of the uterus. Like the tie on this bag, it remains closed during pregnancy to keep the contents inside. It opens slightly to allow menstrual blood and tissue to pass during menstruation, but must dilate to 10 centimeters prior to birthing a baby. 10 centimeters! That's a big ol' people. The roots colpo and vagino both mean vagina. The vagina is the portion of the female reproductive system between the cervix and the external environment. It is a passage for menstrual flow during menstruation and the baby during birth. Pelvi means pelvis. It is included in this lecture as the pelvis houses the female reproductive system. And now for a 10-second brain break. Let's continue with the discussion by looking at the female reproductive system as it pertains to pregnancy and birth, or obstetrics. Parto and nato both mean birth. You can hear them in the words neonate, which is a newborn, and postpartum, which means after giving birth. This is a picture of an intrapartum woman in the process of giving birth. What? You thought a stork brought them? Sorry, but no. And what a terrible idea, letting newborns fly hundreds of feet in the air and nothing but a flimsy sling carried by a creature with a brain no bigger than a teeny tiny little bird head. Terrible. Feto is the root for fetus. An embryo is the earliest stage of development up to 9 weeks after fertilization. After that, it becomes known as a fetus until birth. Hi, little fetus. The amnion and chorion are the sacs that surround a fetus in utero, kind of like this sac is holding this baby, only before it was born and covering it completely, and filled with fluid. So maybe not much like this sac. Perhaps you've heard of an amniocentesis, which is when they puncture the sac to withdraw fluid from around the fetus for analysis. It has the root amnio. The root toko means labor, but not this kind of labor, or this kind of labor. This kind of labor. Toko means having your gut squeezed in a vice while simultaneously trying to keep your insides from falling out while you force a human being with a head the size of a softball through a hole normally smaller than a ballpoint pin, all while trying to remain beautiful for the photos and not kill anyone in the process. I mean, labor. Toko means labor. To close, here are a few extra roots related to the female reproductive system. Apizio and vulvo mean vulva, perineo means perineum, and lacto means milk. Ta-da! As with all good things, this lecture too must come to an end. Thanks for exploring introductory terms and word roots related to the female reproductive system with me. See you next time. Hi! This lecture will cover the subjective, objective, assessment, and plan terms related to the female reproductive system. Are you ready? Are you set? Let's go. The following slides contain common complaints and observations regarding disorders of the female reproductive system. Frequent complaints include those related to menstruation and birth. Up first, amenorrhea and oligomenorrhea. These terms mean absent and infrequent or light menstruation, respectively. Amenorrhea is normal during the entire pregnancy, but otherwise abnormal after puberty but before menopause. Oligomenorrhea can be the side effect of certain hormonal forms of birth control. So why is this sentence on this slide? Because, much like people with amenorrhea, it has no period. Menorrhagia is excessive menstrual flow. Sometimes patients also refer to it as having heavy periods. To illustrate, if this is a picture of normal menstrual flow, this is menorrhagia. There is no stopping it. Bleeding through your clothes in a matter of hours is not uncommon. It can also cause anemia and fatigue due to the heavy blood loss. However, there are many treatment options, so talk to your doctor. Dysmenorrhea is the medical term for painful menstruation. For those not on a form of hormonal birth control, menstruation is usually accompanied by dysmenorrhea as uterine cramps. It is also usually accompanied by bloating and fatigue and mood changes and GI issues. Such a pleasant process menstruation is. Heating pads, pain medications, and physical activity can all help relieve most dysmenorrhea. Our next terms are obstetrical in nature. Antepartum, intrapartum, and postpartum refer to the time before, during, and after giving birth respectively. Technically, I'm 14 years postpartum. It's like the gift that just keeps on giving. An amniorexis is a rupture of the amnion or sac around the fetus. This can be done as a medical procedure to help promote labor or spontaneously. When it happens spontaneously, people usually refer to it as their water breaking. Pop, gosh. Braxton Hicks contractions are commonly known as false labor. They are contractions that occur spontaneously prior to full-blown for realsies labor. My doctor said it's like the body practicing for delivery. Personally, I would have preferred to just wing it on the day of. If you ever look at a chart in an OB/GYN office, you might see the terms gravida and para used to describe a patient. Gravida is the number of pregnancies that the patient has experienced, and para is the number of live offspring from those pregnancies. If you had one pregnancy resulting in twin births like me, you would be gravida 1, para 2. Double blessings, my babies. And now for a 10-second brain break. Let's finish up with some common diagnoses and treatments for the female reproductive system. Endometriosis is a condition where the endometrial tissue that usually grows and builds up monthly inside your uterus starts growing outside of your uterus instead. This causes debilitating pain with menstruation, including intense pelvic pain. Endometriosis treatment ranges from pain medication to removal of the uterus and ovaries based upon symptom severity. A hysterectomy is surgical removal of the uterus. It used to be one of the only options for the treatment of female reproductive issues, but is done far less frequently now. Menopause is the cessation of menstruation and usually occurs in the late 40s or early 50s. This signals the end of a woman's childbearing years. However, menopause is probably most well known for its incredible physical side effects, including hot flashes, night sweats, and increased irritability or anxiety. Doesn't that sound like fun? I've already told my husband my menopause plan. He is to take me to a deserted island and drop me off. He is not to talk to me. He is not to look at me. He is to send regular supplies by airdrop until it's over. Then he can come get me. I figure the kids will be gone by then, and it will increase the odds we'll come out of menopause still married. Adenocarcinoma is a form of breast cancer that starts in the milk-producing glands or ducts. Prognosis is greatly improved for all forms of breast cancer with early detection and treatment. Please have regular screenings and mammograms as recommended by your doctor. Preventative care matters. These final few medical terms apply to obstetrics. Sometimes labor needs to be induced. Oxytocin is a medication that can be given by IV to induce and/or intensify labor to help that baby arrive more quickly. The term episiotomy is a common one in labor and delivery. Often, the baby is larger than the birth canal and can cause jagged tears to mom during delivery. An episiotomy is a purposeful clean cut to allow baby to pass and is then sutured up by the doctor after birth. This makes for an easier delivery and fewer complications than spontaneous or traumatic tearing. Another delivery term, a cesarean section, or C-section for short, is the delivery of a baby through an incision directly into the uterus. C-sections are usually second options after vaginal delivery and are reserved for high-risk deliveries, multiple births like twins or triplets, or after a previous C-section. Welcome to the world, little one. It's going to be great. As with all good things, this lecture too must come to an end. Thanks for exploring terms related to the female reproductive system with me. I'm glad you joined. Well, there you have it. Thanks for allowing me to share your world for a little while and perhaps impart a few helpful bits of knowledge. Medical terminology is a skill that you won't regret developing, but as with any language, you should try to practice regularly to stay sharp. As we close, I hope that you take a moment to reflect on all you've learned throughout the course. You really have learned a lot. It's my sincerest wish that these skills serve you well for a lifetime of good health.